Good afternoon, everyone, and welcome to episode 2 of our Kamustahan sessions kung saan kinikilala natin at inaalam ang buhay ng ating mga healthcare professionals. Para sa episode na ito or para sa araw na ito, kasama natin si Miss Beatrice galing Las Piñas and of course, my co-host for today, G-May. So take it away, G-May.
Hello po.
Yes, kamusta
Hi.
naman
Hello
ikaw
po.
today?
Okay naman po.
Balita ko take ka ng nag-give ka talaga ng time for us para
Yes,
sa
for today.
araw na to. Yes, okay. So nakapag-launch ka na ba?
About to after this
Oh,
siguro po.
okay. So I hope naman na hindi ka pa naman gutom.
Hindi pa naman po.
Okay, I see. Sige. So umpisahan lang natin, no, Bea, gusto lang namin malaman, what are the things that you've been doing? Kasi di ba you are also working as a nurse, di ba? So we all
Yes,
know na medyo mahirap, medyo stressful right now sa work ng mga nurses natin sa hospital. But how do you enjoy your rest day? Or ano yung mga hobbies na ginagawa mo during your rest days?
Siguro it's not only me but also my fellow nurses that every day off is very important to go out, not just with your friends but also with your family.
Mm-hmm.
That's the only time kasi during your work, we have 12 hours duty every day, like 12 hours duty and another 12 hours duty. So I really make it to the point na to spend time with my family during my off. Ayun, kumain sa labas. Anything na would really take my mind off from work, kasi iba yung feeling kapag kasama mo yung family mo. So that really helps po for me.
Of course. Pero how do you go out? Kasi syempre, in time of pandemic, bawal kang lumabas, di ba?
Right now, sorry.
Yeah, go ahead.
Right now, may mga ano naman po na open. Like, if hindi naman po kami makalabas, I enjoy quality time here at home with my mom. We bake cupcakes during my off. So that's one thing that really, nakaka-relax din po.
I see. So, how aside from baking with your mom, how about any personal hobbies na ginagawa ka na pinagkakaabalahan mo?
Actually, sometimes I jog sa jogging pag may time po, ganyan, for health din. So, ayun po.
So, can you say ba na health buff ka?
Ay, hindi naman po.
Hindi naman.
Hindi po. How I wish. Pero hindi po. Hindi. Just time na makapag-jog or with my friends na makapagkayayaan. So, yun po.
So more on bonding lang talaga with you and your friends. Just to relax, to feel relaxed. Yeah, I see. Sige. Now, I would like to ask you, this is regarding your profession, okay? We just want to know lang, bakit mo napiling maging nurse?
Siguro this is the end time that I answered that question. Pero I'll still have the same answer naman po, that back then it was family influence. Yung family ko po, as a side ng mom ko, my titas are nurses po. Some are in the California and some here in Davao naman po. So, ayun, I'm an only child. So, yung greatest dream ng nanay ko is to follow the steps of the family. So, ayun po, the influence of my family is a big part of this choice naman po, to be a nurse.
Anyone in your family, like your parents, are also working sa hospital?
No. Actually, it's only me and my mom. So, yung mom ko naman, hindi naman siya medical field. So, ako lang po talaga yung person.
Okay, I see. Ayun. So, right now, what area are you currently working in or assigned?
Right now, ma'am, I'm in general ward, which we cater medical surgical patients. Also, right now po kasi during the pandemic, nag-cut down yung hospital namin. So what happened to our area, naging step down po kami ng COVID patient. So if a patient came out negative po, and then that's the only time na move out po sila sa ward po namin.
I see. Okay. So you don't really cater non-COVID patient, COVID patients sa ward kung saan ka naka-assign.
Yun po yung idea is to
Yeah.
cover non-patients, but just recently we had patients na came from negative, came out positive again. So from that
Mm,
we had other precautions to follow po, mga ganong situations po.
I see. So it's quite difficult talaga no to still
Maybe.
be under adjustment no
Yes, ma'am.
with our pandemic talaga that's happening right now.
True.
And how long have you been working na diyan sa current na
Ah,
area mo?
just this October, ma'am, I turned my fourth year po.
Oh
Fourth year.
wow. Happy work
Um,
anniversary.
Work anniversary.
Yes, oo. So, what's your most what do you like most rather sa pagtatrabaho mo as a general ward nurse?
Maybe ano po, the thing that I really treasure is that the trust that I gain from my patients, not only with my patient but also with the relatives. Because, during this time, it's very hard.
Mm-hmm.
Parang getting through with the pandemic, these people trust you and your capability to help their
Yes.
relatives to get better
Mm-hmm.
and get, to be discharged from the hospital and feeling twice better than the time they enter the hospital po. So it's very humbling experience every time na these relatives, you get close to them because some patients po, they don't just last 2 days, three
Yeah.
days. We have patients that usually last a week or two. Most of them we have months. So the relationship that we have with the patient and the relative is very, something that I really treasure po.
I see. So at least, diba, you're not only building relationships with your patients, but to the whole family talaga in general.
True, true.
Oo. So, I just wondering, no, kasi not everyone really like the general ward, okay? Just to share with you, I'm also a nurse by
Yes po.
profession, but
Yes, ma'am.
I had a part of my previous years that I worked in the hospital. Pero what is it that, what's the reason, or do you have any reason why you chose working in a general ward rather than in special areas?
Mm, First thing po, the moment I entered the hospital, they already assigned me to that particular area, which is the general ward. And then from then on, maybe I just enjoy the idea. I'm a people person because especially when you're in ICU, your patient is either vented
Mhm.
or they couldn't talk or they're just paralyzed, they couldn't talk, and then you don't you do the routine with them. With the OR naman po, it's just you have the patient lie down anesthetized, so you don't really have that interaction, which I greatly enjoy with the general ward. It's just
Mm,
that you talk with the doctors, you talk with your co-nurses, you talk with the relatives, you talk with the patients, you have that interaction with that, which I really really enjoy, which I really like. That I'm happy that I'm in that area for almost 4 years.
I see. Wow, that's a really good thing kasi there are really a lot of nurses who really want to go around
Yeah.
the areas in the hospitals, diba?
Opo,
So
totoo.
if in case for you, no, if your hospital will ask you to transfer to a special area, will you agree to it?
Maybe yes po, if that would help me grow as a nurse then po and help me enhance my experiences po as a nurse, that would be a great opportunity yun po.
Okay, that's good. Thank you very much for that. Okay, ayun. Now, Bea, I would just like to ask you, no, can you tell me what's one of the most unforgettable experiences that you've had while you're on duty? Okay.
Maybe the thing that I will never forget was, I think that was on my second year as a nurse in the hospital, is that we had a patient, 6-month-old patient who underwent circumcision. That's only his circumcision under anesthesia. So what happened is that during endorsement, the patient came back. So came back from the OR, and then what happened is yung pagkabalik po ng patient sa room, and then yung parent, I was there to assist them, the OR nurse, to receive the patient, to check the ID and all that. And then after po noon a while, we came back to the nursing area to do the endorsement, and then I was sure that the patient was okay. The patient is crying, was really active as the usual. So I went back to my work, and then like 30 minutes after po, the dad was running to the nurse station, asking for help because their baby was turning blue. So I ran as fast as I can to go to their room and to only check that the baby was pale and the baby is pulses. So I was there. I called the cold blue. That's what we call in our area po. So from that moment on, that was my first time to call a cold blue po for a baby. That's so small that time. So we called the cold blue. All the staff was with me doing the resuscitation. And then I was there, parang I was really shocked at that moment because I didn't know what to do. I'm used to the adult CPR and all that. But when I get there, the adrenaline of saving that baby's life was there. I was there to help the baby. So during the CPR, all the doctors were there. We're trying to revive the baby. The same time goes with the parents who was there, who's witnessing what's happening. So for me po, we saved that life, the baby's life, that moment po. I was very glad to be part of that moment po na we were able to save that life, that's precious life of that baby, that moment, that parang people like this po, yung parang wala po silang, they don't have yung mga baby kasi parang they're so precious that they couldn't ask for help. So parang you were there to continue their life, and yung priceless moment that time is yung ano po yung parents when they just hug me, that after that moment na na-stabilize yung patient or able to the patient was vented that time, so the baby, so we had to transfer to the ICU. But yung moment po kasi na nabigay mo dun sa family, it's something priceless. I mean, yung pagod po would always be there. Yung pagod mo and every... So, naramdaman ko na rin yung pagod after mo ma-stabilize yung patient Kasi puro adrenaline yung nararamdaman ko that time. But the moment the mom hugged me, na parang will saying thank you, parang it just melted my heart po. Parang I was really born for this profession for myself. Parang sabi ko, yun po yung no amount of money could, makaya pong yan. So, yun po talaga yung And then luckily, after the baby was stabilized, the baby was transferred out to our station again. So, very naka-recover siya from that moment. And the mother asked everyone, me and my coworkers, to be the ninang of that baby. So, grabe talaga yung namin with that patient. So, yun po talaga. That's one of the unforgettable po.
So imagine that it was your second year, right? Sa hospital.
Second
Yung time
year
na
po.
yun. Yeah, so parang it's really something that you really cherish for the rest of your life. Right. And you mentioned that this is your first time doing resuscitation to a baby.
Sa babies. Opo.
Yeah, oo. Kasi nga, since you're on general ward, you're much more comfortable in doing it to adults, right?
Though we cater pedia patients in our ward also, but it's very na mag-code yung pedia during that time. So parang it's a very po talaga situation for all of us. Opo.
Saka you mentioned nga, baby yun. So parang syempre,
Yes.
nandun and stress, diba?
Totoo.
Oh, so yun. Our next question, no, Bea. Yes. Let's go into some a bit more personal. Okay. So can you tell us how did COVID change your life when in terms of your personal and career?
For me, ma'am, when I think of 2020, I also think of hope. I want to impart not only to myself but to every person that I meet that 2020 is not a bad year after all. 2020 is a year of hope. The resilience in every person that you see, especially to us Filipinos, that's very known for us. So I want to tell them that there's hope, that despite that what's happening around us or every person, that there is hope, that nothing is impossible with our God. After this or after what happened, there is hope. Diba, parang hirap po kasi isipin ngayon na this is happening po, na hindi natin alam when can we have the vaccine or will it be effective? So parang I wanna tell the people to remain positive, to have that hope within them na kasi po para siyang domino effect. When you share that, pag walang hope yung the people around you, sometimes you feel hopeless din po na
Yes, that's
na
true.
matatapos din to, na there is an end, matatapos din siya, and everything is gonna go back to normal. But this time, with precautions nga lang.
Yes, of
But it's
course.
gonna be better because everyone around us will benefit din po. So that's one thing that I learned from this moment, from this pandemic, is that to remain hopeful, to have that hope within us that there is the greater thing waiting for us on the other side after this moment po, after this chapter of our lives po.
Yeah, so kumbaga after ng 2020, we're hoping
Hopefully,
talaga that there a new beginning, kumbaga, with the new normal
opo.
coming 2021, di
Yes,
ba? So,
ma'am.
can you try to tell us, Bea, what's the reality ba of being a nurse working in a hospital at at this time of pandemic?
So, I've been a COVID nurse din po. We've been the one, kami po yung nag-start while COVID while still happening po. Nagsa-start pa lang po siya. We were there. We were assigned to a COVID area po. What happened is that it is a specialized, na po parang sa amin po specialized na yung area. We make it as much as possible to less the cross-contamination from the patient that are positive, from the patient that is only a PUI. So parang ang iba lang po talaga is the preparation eh. It's like the wearing the PPE itself. It's a different story talaga kasi we have a 12 hours duty every day. During the 12 hours, you only get to go with the patient 3 times a day. So I 3 times per shift. So I go to my patient if I have a 6 a.m. to 6 p.m. duty. I go to my patient 8 in the morning to give them medicine and their breakfast. And then after that, 12 in the afternoon to give the medicines again and the lunch, and then 4 p.m. for the medicine. So just imagine that as a nurse po na parang you have to do your nursing intervention in that certain time with that limited time. Parang you have to really do your best to give the support, emotional support, you know. Ang hirap po kasi kapag pasyente ka nowadays in the COVID ward kasi you stay there by yourself. May camera lang to watch over you dun sa room mo, give you medicine, the food, and after that, you're by yourself. So parang grabe mami, grabe po yung experience during that time po. During COVID nurse, kung ano po yung nakikita natin sa news na walang tanggalan ng PPE. That is true. Kasi lalo before po we experienced a lack of PPEs before. You know, hirap po na, you don't want to risk your life to get that COVID, but still, you're on that point that you want to give that comfort, that care that these people deserve. Kasi just like us, they're scared. You know, to be in that situation, ma'am, they're scared. Parang kahit na sabihin natin nandun tayo to help them. But you know, mahirap po kasi talaga na nag-iisa lang sila getting through the situation, the depression po. So parang at the same time, you're thinking of yourself, you're also thinking of that patient po on how you make them feel better, that na kahit na ganito yung situation, you'll help them cope up with the situation din po. Kasi when they're sad and they're depressed, that won't help them physically. So parang that's what I always tell my mind, that when you enter that patient's room, you have to give them that hope. Like what I said earlier po, you want to give them that hope that they'll get out of this hospital negative and they can go back to their usual life po.
That's true.
Ayun.
Na yung kumbaga, they're gonna live their life like
Yes,
nothing
ma'am.
happened, di ba?
Yes, yes.
So, as a nurse, di ba, who really took care of them, it's also your like fulfillment then, di ba? To see
Yes,
them
ma'am.
being healthy, going outside na without
Yes,
really
ma'am.
need to go back or to return sa hospital ninyo, di
Yes
ba?
po.
So, what keeps you moving? Or despite the challenges, what's your motivation, Bea?
Siguro po, I feel so grateful lucky at the same time because it was a God-given talent eh. It's just a God-given opportunity to be in that situation to help other people. Kasi while others are on lockdown, while all the people, our family stays at home, we were there. We were there for that patients. Parang I feel so grateful na lahat ng tao naka-lockdown, I get to be with that patient. Na parang I feel so humbled lang po na I can be the nurse that I ought to be na sinumpaan ko to be in that certain situation. Kasi, di ba ma'am, parang in a pandemic na ma-experience mo siya in your lifetime, di ba ma'am? So parang mas gusto ko na lang pong gamitin yung capabilities ko in the right way na matulungan din po talaga yung mga tao. And that inspires me to get up every day during that time, ma'am. Kasi I was, rin po nasa hospital din po ako natutulog for 3 months. I stayed in the hospital po. So parang duty tulog, pasok. Ganun po yung nangyari sa akin. Which I'm really grateful for din po. Kasi, yung hospital din naman po provided us yung house, yung food that we needed. So, ayun po. Parang everything came into place din naman po na, lalo na po that time kasi ang dami po talagang tumutulong, nagbibigay ng food sa mga frontliners which I'm super grateful kasi makikita po talaga sa mga Filipino yung mga being helpful po talaga in this time of situation. So,
It's true. So, yeah, we would really want to thank everyone, no, na nanonood nitong kamustahan session natin, right? Who really shared their, kumbaga, their piece of something, di ba, sa mga frontliners natin. So, thank you very much, everyone, no? Ayun. So, yeah, very quick lang, no? Let's do a quick icebreaker lang para medyo ma-relax naman tayo ng konti, no? So, if you're familiar with Fast Talk, okay?
Ay, sure, sige.
Yeah, so I'll be asking you some questions, okay? So, mabilisan lang natin na tanong. Okay, ready?
Yes, ma'am.
Yes. Okay, so Jollibee or McDo?
Jollibee.
Jollibee. Dogs or cats?
Dogs.
Morning or night person?
I'm a night person.
Do you like to travel ba, Bea?
Yes po.
Okay, so let's see. Japan or South Korea? Japan. Okay,
Japan.
I know. Bakit Japan? Oh,
I think it's with the food. I don't know. It's the food that, especially may mukbang on YouTube that makes you,
Yeah.
I want to try that.
So what's your favorite food, Japanese food ba?
It's the gyudon. It's the sushi that serves freshly made sushi.
I want to join you with that mukbang because I also love.
Yes,
I also love Japanese food actually.
Yes.
How about the chocolates? No, flat tops or chocolate?
I go for flat tops. Kasama ko yan sa review ko that time, so I go for flat
Yeah,
tops.
I know, right? I also did that one. May kasama pa akong mani, di ba? They said kasi peanuts are make you a bit more brilliant. I don't know.
Advice din yan during the review. I had this picture took by my review mate kasi mayroon yan sa bag ko, isang bag of flat tops sa bag ko. So they know na ako lang yung magdadala ng flat tops during my review. So
mas ayaw mo pang mamigay, no? Kasi baka maubusan ka. Ayun. And last question. Sunrise or sunset? Sunrise or sunset?
I'd go sunset.
Sunset. Why is that so?
It's the magic of the new beginnings naman po. Some days it ends, but the sunset promises you a new beginning.
Yeah, I totally agree with that kasi sunset.
Yes.
Yeah, ayun. So thank you for answering those questions. Okay, we're already on the latter part. Okay, actually last part ng ating session. Okay, so do you have any what they call this? What does being a nurse, your profession, mean to you? Ano bang ibig sabihin ng pagiging nurse for you?
I guess if it comes to word, it means compassionate po. It taught me to be compassionate. Like what I said, the relationship that you earn during your time as a nurse is the thing that you will bring with you all throughout your life. Sabi nga nila, a nurse is either a patient will change your life or you will change their life. So parang that's something that I'm very, very, yung pinadaling ko all throughout my life, that somehow I change someone's life by my profession po. Ayun
Yes.
po.
And what's your message? Can you give us a message, or can you give your message to your fellow nurses?
To keep doing what you're doing. You just love what you're doing kasi sabi nga nila, when you do what you love, you don't feel like working every day. You
That's
just
true.
learn how to love what you have. Kasi po, parang the opportunity to serve other people is a great thing po. Parang it's a rewarding feeling that no amount of money could, parang kayang pantayan po yung amount of gratitude that these people could give to you po as a person, that will help you really to boost yourself every day, to push yourself even more to be a great nurse to the future patients that you will encounter din po. Ayun lang. Just keep doing what you love, and then appreciate and be grateful and stay strong. Alam ko it's been a tough job. I've been there. Gusto ko nang bumigay every time. But just God is just great. He gives you a lot of reason to stay on your feet, stay on your ground, to keep doing, to keep pushing yourself. Kasi po, it's like returning the favor to people naman po. These people deserve the best medicine, or deserve the best care that you can offer to them. So ayun lang po. Just keep praying for your health, especially this time of pandemic. Just take your vitamins, take care of yourself, but especially the more you work, the more you give time to yourself also. Kasi
Yeah.
hindi naman mag-work ang isang bagay kung overwork tayo. So I
That's
advise
true.
everyone to take time to relax and rest, and don't be guilty. Anything that will make you feel relaxed, or feel good, do it, because you deserve it. You deserve the rest. You deserve everything, because you guys, we've been working hard during this time po.
Yeah.
Yun lang.
Ayun. Thank you very much for all those very inspiring words. And thank you very much again. You're not really giving up, no, until now. Go
Yes,
pa
ma'am.
tayo.
Don't
Stay
give up lang po
strong.
talaga.
Yes. So yeah, so that's it for those questions. Thank you very much for your
Thank you so
time.
much, ma'am.
I
Thank you
really
so
had
much.
fun talking to you today.
Like as well, ma'am, maraming salamat po for taking this opportunity na ma-invite po ako sa inyo to be in this talk show po. Maraming salamat din po.
Yes, thank you very much, Bea.
Thank you, ma'am.
Yeah,
Shout out
shout
to my
out.
mom na sumigaw earlier, but she understands now. But ayun, I would like to thank, syempre, my family, my hospital, Perpetual Las Piñas, and everyone who knows me. Hello.
Okay. That this is the second episode of Kamustahan session. So thank you very much again to our guests, Bea, and of course my co-host for today, Jimmy. So with that, bye-bye.
Thank you po.